Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marcia Teele. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on caregiversolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teele, as she brings information to you that may just be the caregiving solution you need.
Hi, everybody, and welcome to Caregiver Solutions Info. I'm glad you're joining us today, either on your computer or on the radio locally, wherever you are. We're here in South Florida in Boca Raton, and it's a lovely hot day. And so I want to welcome you to our show. This show is for caregivers, family caregivers, that are involved with diseases like Alzheimer's especially, or other related dementia. It doesn't have to be Alzheimer's. It could be perhaps vascular dementia. Lots of things can cause dementia. But if you're a caregiver and you're dealing with memory loss in a loved one, this show is for you, because we bring experts onto the show that will help you, give you some great advice, give you some tips, answer some questions, and make you a better caregiver by perhaps giving you the answer to something you're struggling with, or making you feel like, hey, I'm doing all right. I've done that. That's good. I'm on track. So whatever you are, wherever you are, I'm glad you joined us, and we're excited to have you here because we've got a great show today. Today is Tuesday, August the 25th, 2015, and today's show is going to focus on Medicare home health. It's going to be really informative, and you won't want to miss a word of that. But before we get there, I want to give you our weekly Brain Boosters. Now, Brain Boosters is a little segment of this show that's going to give you a little tip every week to either inform you of how to maintain your brain or to maybe improve your cognition. Some little something that's going to say, hey, maybe I should do that. That's going to make my brain a little better. So last week we talked about dancing, how dancing is great for you. It's great exercise, gets the blood flowing, gets oxygen to the brain, and every week we'll be talking about something different. So today I want to share with you, you know that old phrase that people say, you are what you eat, right? So if you eat lots of donuts, you're going to look like a donut. Well, you are what you eat, and it's important to think about what we eat, because what we eat goes into our body and it feeds our brain and feeds lots of our cells, but some food obviously is better for us than others. And so research has shown that our diet is very, very important, because our diet can actually help prevent getting diseases like Alzheimer's disease. Now, no one says it's a foolproof, but anything that we can do to help our bodies and help our brains, wouldn't we want to do it? So, for instance, your diet plays such a big role in what happens to us, and obviously, with everything that goes on, we want to do what we can. So, the Mediterranean diet is one such diet that's been associated with less cognitive impairment. Now, why is that? People that eat a Mediterranean diet, which is fish, lots of vegetables, olives, olive oil, those people have been in studies and shown that their cognitive functioning overall is better than people who don't eat that type of diet. Also, a diet that is high in non-starchy vegetables, now that cuts out French fries and potatoes and rice. Those are starchy things. We don't want the starch, but non-starchy vegetables, bright vegetables, yellows and oranges and greens and reds. If your diet is high in those types of vegetables, and also fruits, nuts, and berries, they all have some protective qualities. So you want to load up on those. Put a lot of those on your plate, and not so much meat, lots of fish. Antioxidant compounds is what we're looking for, and those have antioxidant compounds. But there's especially high antioxidant compounds in tomatoes, in tea, in cocoa, and wine. Yes, wine is good for your brain. So you want to have lots of these things ingesting to go throughout your body. Not only are these things good for your brain, they're good for your cardiovascular system too. And so what we eat is who we are. So we want to be healthy. We want to be physically healthy. We want to be brain healthy. So enjoy that Merlot in moderation, of course. It's good for your brain, and it's also good for your mood. And so we want to do what we can and eat healthy and eat well. So we're going to take a quick commercial break, and when we come back, you'll be introduced to two professionals in the home health care field, and they're going to answer lots and lots of great questions. So we'll be right back.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. Make First Choice your first choice for home health care. First Choice is state certified for Medicare covered services such as medical treatment and rehabilitation. Qualified healthcare professionals come to your home and work closely with your doctor to build a care plan designed to get you back on your feet as soon as possible. Founded and operated by registered nurses, First Choice Home Health is dedicated to providing exceptional home health care. Their highly skilled medical professionals have the knowledge and ability to provide patients quality care. Call First Choice Home Health at 561-296-2770. That's 561-296-2770. And tell them you want them as your first choice.
Hi, this is Marcia Teele of CareGiver Solutions Info. I'd like to tell you about Senior Home Companions. They provide care in the home for seniors by active seniors. The caregivers are mature men and women who understand the needs of seniors. Caregivers are individually matched to each client, creating a bond and a high level of comfort. A nurse registry, Senior Home Companions have been assisting seniors in Palm Beach County for 17 years. For a complimentary assessment, call Gloria at 561-347-6676 to see how a Senior Home Companion can help you.
You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
Hi, welcome back. Here in the studio with me today are two professionals from First Choice Home Health, and we're going to be talking about Medicare home health. So welcome. This is Lisa Knoll and Brendan Gibbons. Thank you so much for joining us today.
Thank you for having us.
You're very welcome. Lisa, you are the president and CEO of First Choice Home Health, and you're also a registered nurse.
That's right.
Okay, and Brendan, you are a business development specialist.
That's right.
Okay.
Right.
What is a business development specialist?
I'm just going out to doctors, senior livings, and trying to get them to use First Choice and trying to sell the idea of, I believe that First Choice is the best home health company out there.
And you're educating them not only just on your company, but what your company can do for them.
Correct. So what First Choice has to offer to them, that what makes us special other than other home healths.
Okay, so you're educating doctors as well as professionals,
Yes.
right? And that's good because, even doctors need to learn things, as we all know.
Yes.
So that's great. And Lisa, you're a registered nurse, and you started this company. Right. And how did that happen?
I was working in the home health industry for a number of years. I've been a nurse for over 20 years and had worked in home health for quite some time, and always felt like nurses understand what nurses want, and we primarily do nursing and physical therapy. Obviously, we have some other services that we offer as well, but a home health company is anchored by nurses.
Okay.
And we just always felt, the three of us, we're owned by three nurses, and we just always felt like it was a really good thing for the nurses to understand where everyone is coming from. And usually it's a female, and usually it's a person who is a very caring person, and it's usually the breadwinner even in their family. So we felt like we understood that.
Very good, very good.
Well,
so home health, we hear that all the time. We see billboards about home health. We see in the yellow pages home health. We see advertisements in the newspaper about home health.
Right.
Now, if someone has never needed to use home health, they might not know exactly what it is or when they might need to use it. So can you just tell us basically what is home health?
Home health is a Medicare and other insurance covered service where, like the name says, you get your primary care in the home. So what we do is skilled care. Now, there are other agencies that do other types of care, but we do a skilled care, meaning if a mother or grandparent or something breaks a hip, we're able to, after the surgery, rather than have them go to a rehab or a nursing facility, we're able to treat them in the home from a nursing standpoint as far as the wound that was created by the surgery, and as far as getting the person back on their feet with rehab in the home. So we're able to do those things in the comfort of their own home. And that's what people really love and really want. And of course, it's at a fraction of the cost.
So if someone is in their home, they want to return to their home, but they still need to get some services. So you actually send people into the home. What if someone lived in an assisted living or an independent living? Would that still qualify for you to come in to help them?
It certainly would. It certainly would. If they have an independent, would be almost like living in your own apartment. So, or your own home. Wherever your home is, as long as it isn't a service that's already being covered by another insurance or by Medicare or Medicaid, we're able to go into any type of assisted living or independent living facility and help the person to recover after any type of surgery or illness, or something simple like a biopsy at the dermatologist's office. If you can't reach your back to get to the biopsy site to put a bandage on it, provided certain other qualifications are met, you're able to have home health.
Wow. So your home health is Medicare, but there's other home healths that are non-Medicare, or what they call private. Can you explain the difference between those two?
Absolutely. A private home health company might be someone who sends nurses or home health aides out for a block of time, where if a parent or grandparent needs someone to sit with them for a period of time, say 4 hours or 8 hours or even the whole day, a lot of private agencies will send someone out to spend time and stay in the home to help cook meals and with bathing and things like that. That's not the kind of home health that we do. We do something, it's more intermittent, and it's skilled care, meaning I send out a higher level employee, an RN, an LPN, a physical therapist.
Skilled care is like what somebody would get if they were in a skilled nursing facility?
Similar.
Okay.
Similar to that, where we do some high-tech care in the homes, but if a person needs round-the-clock care, then of course they would either need someone in the home with them, or to be in a facility. But we provide those skilled periods of time. If the person's okay to be independent in the home or has another caregiver, like a family member in the home who's caring for them, they could stay in the home during regular times. We can come in and do wound care. We could come in and do a nursing visit for another problem, including hypertension or diabetes or a psychiatric issue. And at the same time, we can also offer physical therapy, occupational therapy, speech therapy. All of those skilled providers are working for our agency and are able to go out into the home and provide any or all of those services that are needed at any given time.
Wow. So how does somebody know whether they would qualify to have a Medicare agency in their home to help them?
Okay, so if they had any kind of an onset of any kind of a new disorder of some kind, say somebody was recently diagnosed with hypertension and they just had gotten on some new medication, and the doctor wants to have the blood pressure monitored for, say, a period of time, and he wants to be reported to him that, what the blood pressures are. Is the medicine working? Is it not working? Rather than have the patient continue to go to the doctor's office every day.
Which can be really hard, especially if, the person's older or, not so easy to get in and out of a car, or not willing to actually want to go to the doctor, because we all know that happens.
Absolutely. And if the person is homebound, and that's a subject that we'll talk about on and off, but a homebound status, meaning what you just said, you described it perfectly, is that the person has difficulty getting in and out, or they have to make a concerted effort, or it takes a taxing effort for them to get where they're going. Someone has to drive them. Not to say that they're a shut-in. They could still go to the doctor's offices or go to any type of religious services or things like that. But most of the time, the type of patients that we serve in the home are people that have difficulty getting out of the home. So those are the patients that we would treat with any of our services in the home for a finite period of time. Usually a couple of months is the amount of time.
Okay, well, that's fairly convenient, actually. What if there's a couple and the husband has dementia? Say he has Alzheimer's. The husband has Alzheimer's, and he happens to be the patient, and he's got something wrong with him. But the wife, who's his caregiver, she doesn't drive, and she can't drive him to the doctors and get him there all the time to check his blood pressure. Would somebody like that qualify?
Absolutely.
So it doesn't have to be the patient themselves that can't get out, but it could be the fact that the caregiver also can't get them to their appointments.
Right.
Wow.
Memory loss, like any type of a memory disorder, automatically would qualify someone, because it's certainly unsafe for that person to leave home alone.
Yes.
So that person would automatically qualify as a patient that would qualify for home health benefits. And it doesn't just have to be if he has something physically wrong. If a patient is newly diagnosed or diagnosed with Alzheimer's and is placed on a medication that the doctor feels could be something that could become toxic, or that he wants to really monitor the
level. Or maybe
level.
Something he might have a reaction to.
Certainly. Any type of an allergic reaction. If he's tolerating the medication, we have psychiatric nurses who will come out to the home to evaluate that, who's all have Alzheimer's training. And they would go out to the home, and they would help, like you said, they would help the caregiver as much as they would help educate the patient while they're out there.
Mm-hmm.
So
things you can do in the home that would be really a big relief for some people that couldn't schlep out to a doctor's office all the time, or it was somehow burdensome for them. That's going to save them time and effort and money, probably, even if they had to, hire someone to take them or hire a taxi to go, because you go to them.
That's correct.
Wow,
right.
That's awesome.
Right.
So when someone has Medicare, they're on Medicare, and they have a need, And so let's say that they go to their doctor and the doctor maybe does want to put them on a medication. And they do need to be monitored because, a lot of even these Alzheimer's drugs, there's reactions because not everyone tolerates them well.
Correct.
They have some adverse reactions, vomiting, diarrhea, all these different things from just simple things like Aricept or Namenda. And so the doctor wants to put them on and monitor. So that's something that a nurse could do to monitor, but also make sure that their blood pressure is still stable, make their heart rate, and do all this and report back to the doctor.
Absolutely. So a head-to-toe assessment would be done on the person when you come out to see them the first time, and then they would be evaluated medically each time the nurse returns to the home. So, and then also we would educate the family member about what to look for if there are any problems. And sometimes the specific dose of medication that these people are given initially, everyone's different. So sometimes we overshoot the mark and it's a little too high. Mm-hmm. A nurse would be able to catch that right away and say, listen, call the doctor and say, I see a reaction taking place, or I see the person's not tolerating. The doctor may stop the med and start something else, or may just simply cut a dose of a medicine in half to see if the patient could tolerate it at a lower level.
So one of the home health nurses could be like the first line of defense.
Absolutely.
And catch things before it got worse.
Correct.
And report back to the doctor. They have a direct line to the doctor, to your family doctor?
That's right. What we would do is we would work closely with the physician to develop a care plan. Mm-hmm. And the physician would be involved in that, review the care plan, and understand what the care plan is. And then when we go out to the patient's home, we would report that directly to the physician if we saw anything outside of what we would consider to be normal. We would report that immediately to the physician so that they would have the information to make the change without having to have the person go to the doctor again, which is going to be disruptive if the person has any type of a memory problem.
That's right. That's right. And you mentioned that you have psych nurses. Now, I'm interested in that because, my passion is Alzheimer's. And, with Alzheimer's come a lot of behaviors that aren't normal for that person, possibly. They sundown, they have different behaviors and in their home, and it's hard for caregivers to deal with that. What could a psych nurse do that under Medicare that could help a situation like that?
What we would normally do in those types of situations is we would go out and, again, create a type of a care plan. Now, depending on the stage that the person is in, one of the things that we use as a tool in the early stages is we'll create a memory book for the person.
So what does that involve?
So in the beginning stages, they're in and out of the memory loss, and there will be times when they're completely lucid, and then other times when they really don't have any idea what's going on.
Right, it comes and goes.
So very often we create a memory book. It's simply a binder with pictures and answers to frequently asked questions. So if the wife gets sick of saying, what's for dinner, and the gentleman maybe has asked the question way too many times, she can put an entry in the memory book, and she could refer him back to the book and say, Barney, can you take a look at the book? I just wrote that down for you. And then he looks and says, oh, we're having pot roast. And then that may satisfy him for a period of time. Or maybe even if he isn't too far into the disease, he may realize on his own that he already has the answer and go back and look into the memory book. Sometimes we put pictures for prompting, and a lot of times we use verbiage writing, and sometimes we'll enter certain things into the book about what went on during that day, and then sometimes he can actually or she can actually enter things on her own in those moments of lucidity.
Wow, I didn't realize that you did that. That's really interesting. Now, who puts that together? The home health nurse?
The home health nurse would help the family to put that together. And again, it's simply a binder, and you can have it as elaborate or as simple as you'd like. A lot of times, current pictures of grandchildren, as the memory starts to fade, the memory isn't of the most recent thought of the grandchild.
Right.
So it would be really nice to have the current pictures along with pictures that were of the children when they were younger. And often having the person in the picture who has Alzheimer's is great for them. It prompts them very nicely to remember being with the family and then remembering at least a moment,
Right.
or having the picture fill in for the memory, even if they don't have it.
And a lot of times that calms them.
It can be calming.
It can
sure.
be very calming, and they can be reflective. But what happens when the stages obviously are going to progress with Alzheimer's disease, and a person goes to, more of a moderate to severe stage, and maybe they're sundowning and they're very aggressive and they're shouting or they're threatening to hurt their spouse because they don't realize what they're doing. But it's very disconcerting to somebody when they're dealing with a person that they no longer know anymore, because this wasn't how you've been for the last 50 years, and now all of a sudden you've changed. And this is scary for some people in the home. Is there anything that a psych nurse could do then?
Absolutely. Now, at this point, there are pharmaceutical interventions that may take place or may be necessary. And we would obviously need to get the physician back involved as the person progresses. Sometimes we do, at certain stages, have issues with the person having a combative component to their disease. And then sometimes as the disease progresses, that actually goes away. But during the combative component, which can be very scary, and if the abuse is involved, then certainly we would intervene with any means necessary. But if it's just somebody who's getting agitated at a certain time of day, that might be something where we could talk to the doctor again, recommend that a short-acting medication be given during that time or before, when we know it's going to happen. If it's every day between 4 and 4:30, we're smart people. We need to give the medication.
That out, right?
We need to give the medication
before 4:30
at 3 o'clock.
Right.
So that, the person can, potentially calm down. And when you think about it, and we always try to think of things from not just the caregiver's perspective, but from the person's perspective who has the Alzheimer's. Think how awful they must feel, how agitated they must be. How angry do you have to be to act out, to yell at someone? That must be horrible, to be inside that body and not know.
Well, sometimes they do it, and then afterwards they can actually realize that they acted out. We have, I have a resident that, can get angry and shout and be ugly to a caregiver. And then when he came back to himself in a lucid moment and realized what he had done, he feels horrible. And he apologized. I'm so sorry. I'm just so sorry I acted like that. And then your heart breaks because they can't help it.
Absolutely. And that's part of the disease. So if there's something we can do to help, to intervene, and if the physician doesn't know about it, we just always say that the doctor sees a slice in time.
Right.
And I think this just like with anybody. When you're getting to know a friend, you really don't know them until you go to their home.
That's true.
Right?
That's true.
So we really feel like we're the first line in there. Sometimes we get into a place and someone really doesn't have the appropriate foods. Someone doesn't have the appropriate cleanliness in their home. Sometimes we're the only visitor.
Wow.
And sad as that might be, it just might be myself and the physical therapist that are the only people, or one of my nurses.
I bet they're glad to see you, even if they have to work at doing the exercises. It's like, oh, they're here. I get to do my exercises, and I'm so happy because someone's visiting me.
Absolutely, and it's a really rewarding feeling for us. But it's also such a sad state when you know that all the family is up north or they're in California. And stop me when you've heard these kinds of stories.
Absolutely.
But sometimes we're the only visitor.
Yes. And you're right about the doctors having just a slice of a piece of the pie when it comes to knowing all about them, because, doctors are very busy and they might schedule a 15-minute visit. And how much can they really learn in 15 minutes? And they don't see them that often. And then, during that little piece of time, the patient might be perfectly okay and just be the perfect patient and answer everything perfectly. And then as soon as they get home, it starts all over again. It's like, well, why didn't you do that at the doctor's office? I'm trying to tell him. The doctor probably thinks I'm crazy because I'm telling him, what my husband's doing, but nobody sees it.
That's very common.
So I like it that someone is in the home who actually is a professional, a healthcare professional, who can observe these things and then make reports back to the doctor.
Absolutely.
That's awesome.
Absolutely. That's really the focus.
Wow. I love all this. I love our conversation. We're going to take a short commercial break and we'll be back. in a few moments with Brendan and Lisa from First Choice Home Health, so stay with us.
Take a pen and jot down this information. Right from the Heart assists families in finding the right living arrangements for their aging parents. Founded in 2012 by Sharon Agate, Senior Lifestyle Consultant, Sharon has counseled seniors and their families for over 20 years in clinical settings and in independent assisted living and memory care communities. Finding the right community can be overwhelming and time-consuming. Right from the Heart takes the stress and worry from you. Sharon will meet with mom or dad and evaluate their needs and lifestyle preferences and create a personalized plan at no cost to you. She will accompany you to visit selected communities and guide you every step of the way so you can be assured you're making a well-informed decision. Call Sharon at 561-374-4696. Sharon's promise to you is in your knowing that her advice will always come right from the heart.
Hi, this is Marcia Teele of CareGiver Solutions Info. I'd like to tell you about Senior Home Companions. They provide care in the home for seniors by active seniors. The caregivers are mature men and women who understand the needs of seniors. Caregivers are individually matched to each client, creating a bond and a high level of comfort. A nurse registry, Senior Home Companions have been assisting seniors in Palm Beach County for 17 years. For a complimentary assessment, call Gloria at 561-347-6676 to see how a Senior Home Companion can help you.
Do you need the advice of an elder law attorney but perhaps find it difficult or overwhelming getting to appointments? The solution is the Elder Law Department. They bring elder law to you by meeting with you in the comfort of your own surroundings to discuss your personal situation and family needs. In practice since 1994, Heidi Friedman is a member of the Elder Law section of the Florida Bar. She and her team help families with issues that include incapacity and estate planning, asset preservation, veterans benefits, and other legal issues that seniors may face. Call the Elder Law Department at 954-383-1143. 954-383-1143. They bring elder law to you. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
Hi, thanks for joining us on CareGiver Solutions Info. We've been talking about Medicare home health, learning all about it, what it can do to benefit us, and so we know what we can get and what we can't get. Before we join our guest again, I want to address to you, the family caregiver. Are you stressed out? Are you overwhelmed? Do you not get a break during the day? It's really, really hard, and caregivers need to take care of themselves. One of the things that our national sponsor, Arden Court's Memory Care Community, is offering to you, the family non-paid caregiver, is a free day of respite. What's respite? Respite is a time for not only you to get a break, it's a time for your loved one who you're caring for to get a break from you too. And believe it or not, you need a break from each other. And so if you don't have someone that can watch your loved one while you go to the beauty parlor or go to a doctor's office and have an appointment for yourself, or maybe just to go to the spa and get a massage, Arden Courts would like to help you out. So call Arden Courts. There are over 50 Arden Courts throughout the United States. We have 10 right here in Florida. Their toll-free number is 888-478-2410. Tell them that you heard about the free day of respite on the Caregiver Solutions Info radio show and that you'd like to learn more about that and take advantage of it. They'll hook you up with the closest Arden Courts that's near you, and then we'll work with you to plan a day so that you can have time for yourself and your loved one can come to an Arden Courts, participate in activities, be with their peers. Everyone is involved in activities all day long. They can stay and have a free lunch and have a good time, and you will be satisfied because you know they're in a safe environment, people are watching out. Arden Court's the expert, one of the best experts there are on dementia and Alzheimer's disease. So your loved one would be cared for by a great healthcare professional, and you get a time for yourself. So take advantage of that and call them at 888-478-2410. And now we're back with Lisa and Brendan from First Choice Home Health. Thanks again for being here today. So we're talking about all of these different things that Medicare pays for. And I work with a lot of caregivers, and I know that they don't know everything because you get to be Medicare age, and then you start having ailments, but as the baby boomers are aging and we're all starting to, have our little aches and pains, we don't know what all of our benefits are. And so for a caregiver, I think it's even more important to know what Medicare will pay for if you're really needing this type of service. So run down, again, some of the services or all of the services in general, the categories that Medicare will cover in someone's home.
Okay, well, skilled nursing, and when you say that, it's like, well, what is skilled nursing? Well, it's anything from a wound to any type of disease management, congestive heart failure, hypertension, any type of cardiac or pulmonary issues, anybody that's on new medication for any of those, if they have a Foley catheter or a G-tube or a colostomy.
Wow.
Any of those things, any type of diabetic teaching for diabetic management, as well as any mental health and Alzheimer's type issues. So that's just the skilled nursing component of it. We also do physical therapy, which would include any type of therapeutic exercise, gait training.
Gait training meaning how to walk better?
Yes, right.
Maybe with a walker?
Yes, if they need a walker. One of the things that just is maddening for us is when people end up with just a cane or a four-pronged cane. They become so dangerous around the home because they're really not. It's not really a stable.
It's not stable.
No.
They don't have their balance. To me, they always seem to be off balance. It's one-sided.
Right. Mm-hmm. Absolutely. So what's happening is they'll grab for furniture and things like that on the other side. So walker training, any kind of gait training, or certainly any type of assistive device training that they may or may not need. Occupational therapy. We do the fine motor skills with that and help with activities of daily living. People that have low vision and things like that.
Tell them what activities of daily living mean.
Oh, I'm sorry. Activities
I
of
mean,
daily...
I know and you know,
Yes.
but I'm not sure everybody else knows.
Activities of daily living are just the things that we do every day that get us up in the morning. We get up, we take a shower, we brush our teeth, we brush our hair, we wash our hair and dry our hair and those kinds of
We
things.
get dressed.
Absolutely. We dress ourselves,
Tie our
put our
shoes.
shoes on, tie our shoes, and all of those things can become taxing. So we also have a home health aide available that goes out just for a segment of time. It isn't anybody that stays in the home, but it's just short term. And the home health aide will go out and can go out 3 to 5 times a week to help with bathing, dressing, and those kinds of things that the person needs help directly with those things. So
And
again,
Medicare will pay for that.
Medicare does pay for that as part of the service, yes.
Okay. Now, if were you finished with all the categories?
Well, we have speech therapy.
Okay.
We also have speech therapy if anybody's having any swallowing issues, which we know later stages with dementia
Yes.
or any types of memory issues, we often have somebody who will either pocket food or has difficulty swallowing.
Yes.
We'll send someone out, and even someone who will go out and supervise a swallow study with the person, or even get the mobile unit to come out.
I was going to ask you, can that be done in-house or in someone's home, or is it better if they go to an office
There
to do
are
that?
some places that will do it, and it's part of a mobile facility, but usually a lot of the times the doctors will like the report from a specific either hospital or center. We also have social workers who will come out, and that's a really handy thing if someone needs Meals on Wheels set up, or will need any other type of placement or help getting on Medicaid if money is an issue. So we have a social worker that will also go out as part of this. And one of the things that First Choice kind of sets us apart is a little bit different than other agencies. We actually have a registered dietitian on staff. So I have an RD, a registered dietitian, that will go out, and if someone
Especially like diabetic, maybe, right?
A
That'd be a
diabetic
perfect
person
example.
or somebody that is not supposed to eat a lot of potassium. Well, what does that mean? So those are questions.
Green leafy vegetables.
Right, exactly. Or don't eat the banana.
Right.
So those kinds of things, a dietitian can go out and help them figure out how to get the proper nutrition without eating those from a certain food group if that's what they need.
Well, that's really
do.
helpful because a lot of people don't know what is in all the food. It can be pretty overwhelming if you're a caregiver, and then you have to figure out when you go to the store what I can buy, what I can't buy, is this allowed or what's not allowed. It can be very overwhelming on top of everything else they have to do.
Absolutely.
Wow. So if someone needed help like you're describing, how do they first get it? Do they have to get a doctor's order for that?
Yes, and that would be something that we again would follow with the physician. Now, a lot of times, the patient sometimes will go to the doctor and say, "I've been having difficulty with my gait." The doctor doesn't know; they're not a mind reader. So
Right.
if you get to the doctor and you say, "I've been having trouble walking," I think I could use some help with gait training and strengthening or something like that. Getting up and down is more difficult for me. They could actually ask the doctor, could I get some home health visits, or could I get some visits in my home? There's also an outpatient component to that. They could go to an outpatient center. But again, you don't live at the outpatient center. You live in your home.
That's true.
So it's great for you to be able to get home health.
So the
in your-
doctor writes a prescription
Correct.
and says, okay, I authorize, because he's the keeper of the Medicare gate, so to speak, and
Correct.
he has to authorize the service. And so what if the doctor, doesn't ask you and just writes it, or does he have to write it for a specific company, or can you just get that prescription and give it to any company you want?
You could get the prescription and then you could generate it. Now, very often physicians have relationships or like to use a specific agency because of the things we just talked about. They want a specific report at a specific time. They'd like it to include these few things. And there may be somebody they're more comfortable with.
That's because Brendan hasn't gotten to them
I
yet to
know,
educate
right.
them. So you got to get to those doctors, right?
Yep.
So the doctor might say, here, I want you to use XYZ. But if your neighbor's daughter works for a home health company and you really want to use the neighbor's daughter's company, could you request that from the doctor?
Absolutely, absolutely. Patient choice is a very big thing here. The physicians often will choose because, as you're kind of highlighting here, not many people are that familiar with home health. Like, Bethesda's a big building, and Delray is a big building, and Boca. They're hospitals. You see them, you know where they are, and you can request.
Right, you
that.
know which hospital you want to go to. But
Sure.
as far as home health, I mean, can you give me a good guesstimate of how many home health companies are out there just in Palm Beach County?
I think it's 200.
Yeah, that's a lot.
I think it's 200.
I mean, then
with-
you add Broward and add some of the other counties. I mean, you're hundreds and hundreds and hundreds. I mean, I heard one time it was, over 600 or 800 in just the Tri-County area here.
That sounds right.
So how does somebody know, and that's hard. And so, they might hear about a neighbor who had a good experience and they want to use that company. So they need to check it out and ask questions.
Absolutely.
And what are some of the important questions somebody should ask before they choose a home health company?
I think the number of years in business, how satisfied are the patients. Now, all of our data is available online right now.
Yours or
Everybody.
home health?
Every home
Everybody's.
health agency. There's a website that you can go to, and you can see that our line is longer than, for satisfaction. We do a patient satisfaction survey on every person who is under our care. And those are filled out either by the patient that we served or by their family member.
Mm-hmm.
And all of that data is compiled along with data that we send to the agencies when it's a Medicare federally funded, it's pay for performance, basically. They want us to have a certain level of expertise.
So you're required to send these surveys out.
Yes.
I see.
Yes. And
as
then-
well as everybody else.
That's correct.
And then there's a way for a family or a caregiver to rank them or see the ranking on a website?
Yes.
Okay.
Yep. So they can go in and check that to see if the agency they're going to is reputable. We also have been in business, personally, we've been in business for 10 years, and we've never had any type of an issue with any survey that we've ever had. So all of the surveys that we've had completely have been deficiency-free.
So you get audited in like assisted livings and nursing homes. You get audited also.
We do.
Okay.
We do.
They want to make sure everybody's doing what they're
Yes,
supposed to be
and
doing.
you can go online and read those reports as well under the Florida caregivers under myflorida.com. You can go under
myflorida.com is the website.
You can go on and you can read and see what happened with each, and ours are very short. They say no deficiencies noted. But if you do run into a home health agency that either your doctor or someone else recommends, you
Check
can look
them out
up online.
Yeah,
Sure.
Check them out.
Sure.
You want to see what you're getting, right? You want to see what
Absolutely.
your Medicare dollars are paying for.
Absolutely.
Wow, this is great information. We're going to take a short commercial break, and we'll be back in just a few minutes. Stay with us. A little bit more to come.
Take a pen and jot down this information. Right from the Heart assists families in finding the right living arrangements for their aging parents. Founded in 2012 by Sharon Agate, Senior Lifestyle Consultant, Sharon has counseled seniors and their families for over 20 years in clinical settings and in independent assisted living and memory care communities. Finding the right community can be overwhelming and time-consuming. Right from the Heart takes the stress and worry from you. Sharon will meet with mom or dad and evaluate their needs and lifestyle preferences and create a personalized plan at no cost to you. She will accompany you to visit selected communities and guide you every step of the way so you can be assured you're making a well-informed decision. Call Sharon at 561-374-4696. Sharon's promise to you is in your knowing that her advice will always come right from the heart. Do you need the advice of an elder law attorney but perhaps find it difficult or overwhelming getting to appointments? The solution is the Elder Law Department. They bring elder law to you by meeting with you in the comfort of your own surroundings to discuss your personal situation and family needs. In practice since 1994, Heidi Friedman is a member of the Elder Law section of the Florida Bar. She and her team help families with issues that include incapacity and estate planning, asset preservation, veterans benefits, and other legal issues that seniors may face. Call the Elder Law Department at 954-383-1143. 954-383-1143. They bring elder law to you. Make First Choice your first choice for home health care. First Choice is state certified for Medicare covered services such as medical treatment and rehabilitation. Qualified healthcare professionals come to your home and work closely with your doctor to build a care plan designed to get you back on your feet as soon as possible. Founded and operated by registered nurses, First Choice Home Health is dedicated to providing exceptional home health care. Their highly skilled medical professionals have the knowledge and ability to provide patients quality care. Call First Choice Home Health at 561-296-2770. That's 561-296-2770. And tell them you want them as your first choice. Arden Courts is not just a place to live. It's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
And we're back with Lisa Knoll and Brendan Gibbons from First Choice Home Health talking about Medicare home health. So, Lisa, Brendan, I have a question. What if someone's not Medicare age and they need help? For instance, I actually had a customer today whose husband is early 60s and was diagnosed with Alzheimer's disease earlier in the year, and he's got some health issues too. But he's not under Medicare yet. So would he be able to get home health coverage from his other insurance?
Yes, it's a good possibility that he would. A lot of insurance companies now do have a home health component because of how cost effective it is to do home health. Now, our agency is a Medicare agency. We do primarily 98%. There are certain insurances, Medicare replacement policies, and there are certain insurances that we do take, but the majority of what we do is Medicare.
So people should actually check with their insurance company to see if it has a home health component to their benefit, to see if they could take advantage of that through their own insurance if they're not Medicare yet.
Absolutely. And what would happen is there would be maybe a deductible or a certain amount of the Medicare amount that they would be willing to pay. And many insurance companies, provided it isn't an HMO insurance, many insurance companies actually have something similar to the Medicare benefit, or 80% of the Medicare benefit, which many agencies would certainly take.
Right. So good to know. Check it out. It might be something that you don't even know you have, and you might, be able to take advantage of that. But speaking of cost, you mentioned how the home health is less costly. And during the break, you gave me a very interesting statistic. Can you share that with everyone?
Yes. Home health is really the trend. I mean, really the wave of what the medicine, the way we're trying to go, because people are so much more comfortable in their own homes, and it's certainly less expensive. So on average, 2 months of therapy and nursing and in your home would be a similar cost to 2 days of inpatient with testing in a hospital.
2 days.
2 days.
Cost the same as 2 months in your own home.
Yes, so you can see we certainly can do things in a less expensive way with less staff by coming into the home.
And not only is it less expensive, but like you said before, it's in the comfort of your own home with your own surroundings, with your loved ones being there.
Sure.
And I think also, there are a lot of germs in a hospital.
Sure.
And people go into a hospital to get better, but sometimes they come out worse. Right?
That does happen on occasion. And you're better off home with your own germs.
Yeah.
Frankly.
Yeah, you have a resistance to your own germs. But I know people that have gone into a hospital and gotten sicker because they've picked up some other germs there. And it doesn't happen a lot, but it can.
Yes.
So it's another reason to do home health therapy in your own home if you can.
Absolutely. And I think that's a big way of recovering in your own environment is such a really comforting thing for people. As soon as they're able, we would not want anyone to be home and not be safe at home with their wife or with their husband. But if you're able at any point to get the therapy, more intensive therapy, when we have somebody in their home, I can do therapy 7 days a week with them. So if they had a hip replacement surgery and they need therapy 7 days a week, we can come in 7 days a week.
So they don't have to go, like when someone's in a hospital and they've had a hip replacement and they've been in the hospital at least 3 days, then Medicare says they qualify to go to a rehab center. And they go to rehab to get the physical therapy. And Medicare picks up the first 20 days. And after that, it's an 80-20 split with your other secondary insurance. So are you saying they don't have to go to the rehab? They could come to their home and get the same thing, but probably even more because you could do it every day?
That's a possibility, depending on how difficult the surgery was and what kind of shape the person was in before the surgery. But in certain cases, we've taken people back into assisted living facilities in many cases,
right,
where we have said, okay, for the first 24 to 48 hours, the person needs a 24-hour aid. And the aide will go in and stay with the patient, make sure the medications are right, make sure they're getting their medicines. And at the same time, we'll start the physical therapy. And then in a very short period of time, once the people are back up on their feet, they're certainly able to, in a very cost-effective way, get up and walking again. Now, some people do need a short stay.
But then they could finish up at home.
And they
so
could
maybe
finish up at
initially then in the rehab and then get out and get home and finish up.
I think that's the trend we're going to see as well.
Well, I think
but
that's
it makes
interesting.
More sense
it does
to be
make
at home.
it does make sense. Who doesn't want to be home? Everybody wants to be home. So if someone wants to contact you and they like what you had to say, or they had some questions, or they want to find a little bit more about what we're talking about, can they call you?
Absolutely. They can call the office. The phone number directly to the office is 561-296-2770.
You can say that again
So
for them.
561-296-2770. And anyone that answers would be able to help. We're located in Boynton Beach. We have an office right off of 95, so that we're kind of centrally located in the county. We go just in Palm Beach County.
So you do the whole county.
We do the whole
No
county.
matter where they lived, you can still service them.
Absolutely.
Okay.
Absolutely.
That's
and
very-
we'd love to hear from anybody who has more questions or is interested in finding out more about home health, or how to get an order from their physician, or what the issues are. We can talk them through to a solution.
Okay. And I have a question for you, Brendan. If someone went to their doctor and they said, I want to use First Choice, and they didn't know about you, they certainly could call you and say, hey, you go see my doctor and tell them about First Choice, so they'll write the prescription.
Yes, they will.
You could do that.
Yes, they can.
Very good. Well, I want to thank you for coming in today. You were a wealth of information. I enjoyed learning from you and talking with you, and I hope our listeners did the same thing. We want to invite you to call First Choice. Also want to invite you to call Arden Courts. If Arden Courts can help you with your caregiving solutions, we're right there for you. So call us. I want to invite you to tune in for next week. And in the meantime, don't forget, give somebody a hug. We'll see you next week.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teele. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions.